we're just going to open up the Littleton Wednesday, January 6th virtual Zoom meeting at 7 o'clock. And I'll just read the Zoom rules. Town of Littleton began conducting remote participation / Zoom meetings pursuant to Governor Baker's emergency order suspending certain provisions of the open meeting law on March 19, 2020. Since that time, unanticipated legal concerns related to the open meeting law have been brought to our attention by the town clerk. These concerns were supported by the Attorney General's office and confirmed by town council. The one concern is that the chat function allows a parallel text conversation to the board's public meeting. Chat is essentially running commentary that is occurring, but is not moderated or followed by the chair. All participants and listeners may not be aware of the comments being made because some meeting participants join by phone and do not see these conversations. Another concern is conversations between residents within the chat room, which are not incorporated into the public record. In response to these concerns, the town will implement the following changes, which in no way prohibit any member of the public from participating in discussion and sharing information during a public meeting, and will ensure that all listeners and participants have equal access to this meeting. People that join the Zoom meeting are set so their microphones are muted. If you call in by phone, please use *6 to mute or unmute your phone so that the meeting can occur in an orderly fashion. We ask that people who join keep their microphones on mute so that background noises do not interfere with the meeting. If you wish to participate in the meeting, please use the raise your hand function available on Zoom, or if you call in by phone, dial *9, which will activate the raise your hand function. The meeting host will notify the chairperson of the raised hands, and the chairperson will determine whether and when to allow public comment. When called upon, participants should unmute and state their names and addresses. And then after speaking, we request that the participant return their microphone back to mute. All right. Was Katrina coming tonight, or is she still on her little break?
She's attending. Do you want her on a panelist, or?
Let's talk with Jim first about and I guess Jim and Scott about COVID update. Hi, Jim.
Hey, how's it going?
Good. How are you?
Good, thank you. Mike, I got your email or your phone message earlier today. Unfortunately, I started pulling numbers and the day got away from me. So I didn't grab the last numbers until about 6 o'clock tonight. So I can send them to you. I just didn't have them this morning. So yeah, it just, the day got away from me. So the next part of that is, so the number of cases in the last 2 week period were 46. So it's up slightly from the last 2 week period, which I think was 38. Since the holidays, we've seen little bumps, like a couple of day bump. The numbers go a little bit higher than they were in mid-November, and then they seem to fall back down. We're seeing a little bump again. Today's little bump had a bunch to do with the prisons. And when I talk about this, I'm talking about district-wide. The 16 towns had most to do with prisons. That kind of goose in the bump. Otherwise, it would have been a more normal set of numbers since what we've been seeing since the middle of November, which have been higher than before. You mentioned the vaccination clinic. The state asked back in the latter part of December whether boards of health would be willing to hold vaccination clinics. It's all kind of fast and furious. We said we would set up a first responder clinic. We have a location. We have dates that are published up on the state's first responders website. I am finalizing staff hopefully by the end of this week, particularly the vaccinating staff. I met at the site with both Littleton and Boxborough's volunteers to walk the site and figure out what we need for volunteers. We have 2 days set for our 16 towns for the first dose and 2 days set 28 days later for the second dose. I believe we're probably pretty good with all of the vaccinating staff. We do still need to fill spots for volunteers to help us with parking lot flow within the building. So as I finalize that plan, to your point, Lisa, and thank you for the text earlier about looking to help out, we'll probably reach out to other people to help us with flow and work within the facility itself. It's a new vaccine, a new type of vaccine. The handling, we're using Moderna, so the handling's not nearly as difficult, but we are painfully cognizant of the fact that we don't want to waste any of this, and we really want to make sure that once you thaw it out, it has a certain shelf life. and you can move it once frozen. Once it's thawed out, it has a certain time you have to use it. Once you puncture the vial, there's a certain time you have to use it up within. So we're trying to make sure that we stage people coming to the clinic such that we have enough, and they're 10-dose vials. So we need to make sure that we're using it in such a way that we don't waste it. And that's probably giving us the most indigestion out of everything else. The nurses are used to giving shots. It's not like it's any different kind of stuff to administer. We want to make sure we're doing it both right, cold chain storage wise, and right so we don't waste it. So those are some of the last details we're working out. And one of the last details is, other than the shots, we have to record all the people who got vaccinated in the state's vaccine recording system. So the state has software that they gave us kind of the first bit of training on Monday. We're waiting for the second bit of training, which is how the end user, the person, the vaccinator, how that's going to get used. We're hoping that that's going to happen sometime this week because some of the clinics are actually going live next week. We put ours off a week because we weren't sure when the vaccine was coming. We wanted to have a buffer so we didn't cancel. We have to cancel clinics because we didn't either have vaccine or the training for the software. So that's where we're at with our clinics for the first responders. We're getting lots and lots and lots and lots of questions about when can the general public or somebody on a different phase on that vaccination chart, when can they get their vaccine? The only reason we have vaccine at this point is because the state asked us to vaccinate a very specific group, the first responders. And so at this point, the only thing I can say is that we have vaccine to do that task. I polled the chiefs in the different communities that make up the Neshoba district to get a number. I provided that number to the state for vaccine. States provided us with that vaccine. So we don't have vaccine except for those people they've asked us to vaccinate. And it's a really frustrating for the public. I've had lots and lots of conversations, and the toughest ones are with people who are older, who are concerned, who have health conditions, who have loved ones who have health conditions. I can't give them any better an answer than to say, you need to go to the state's website, so mass.gov/COVID vaccine. That's the website for the state's vaccination plan. That's where you'll find the phased plan. That's where you'll find who's in those different groups. And again, it has a timeline. I don't know how strict they're going to follow that timeline. I assume a lot of it's going to do with when and how much vaccine they have. So at this point here, that is, and the other things I tell people when I call is, check regularly with your primary care, because what we were told early on, we boards of health, were that when the vaccine becomes widely available, it should be available at places you normally get vaccinated. So your doctor, the pharmacies. And at some point in time, we, the boards of health, didn't really anticipate having clinics until it was, widely available so that we could give it to everybody. Just because it's a little more difficult to try to figure out a priority group, except, with the first responders, we work through the chiefs. For all those other priority groups, how do you know that somebody has 2 comorbidities? I don't know. So there's those details that we don't have the ability to do at this point, and we don't have the vaccine to do it. So check the website, check with the pharmacies' websites from time to time, see if they're getting vaccine in and when they can do the next group on that priority, and check with your local doc to see if, when we move to phase 2 and you're somebody over 65, somebody over 75, somebody's got 2 comorbidities, maybe the doctors and those practices will be getting vaccine that they'll be able to administer to their patients. And that's what I have for the update. Oh, the state has a new interactive web, instead of the old kind of static information page for COVID, it's now an interactive page. I just looked at it for the first time today. It's interesting. I don't know what to think about it yet. There's lots and lots of things that aren't in the places where I'm used to it being. So I guess that would be my comment at this point. I'm sure once I have a chance to go through it a couple of times, I will find that it's providing me lots more information that's interactive. And it's probably a better source of information. It's just, as you get older, you're used to having things in the place where they used to be. And that's not the case anymore, not as of today. So.
Jimmy, do you have to have 1 shot or twice?
Right now it's 2. 2 doses.
First, they have the first one, and then you have to wait.
28 days. That's right, 28 days with the Moderna vaccine. Yep.
Thank you.
Yep.
Jim, just out of curiosity, how long does Scott have to sit there in the chair after he gets his shot?
So that's part of the training that they gave us. All the Moderna information, all the information on the vaccine, on the administration. So the way we read all that information, it is a minimum of 15 minutes. If people have allergic reactions to the contents of, or potentially to the content, and now I know what the content is, it's propylene glycol. Who knew? Those persons need to say 30 minutes.
Jim, what do you, I understand that it has to be in sub-freezing temperatures, and you said it has to be defrosted? For a certain amount of time?
The Moderna vaccine can be stored in a regular freezer, essentially. It has to be stored between essentially -15 to -25 C, which I wish I knew it's a household freezer temperature. So we have a chest freezer that we purchased for this purpose. It is in that chest freezer. It still does take, so to give you some background, it takes 2.5 hours to defrost it in the refrigerator. It takes an hour to defrost it at room temperature. It needs to be given at room temperature. So those are some of the logistics when we go to figuring out, we want to know the number of people coming every hour so that we know how many vials to have thought out. We've been told at this point, and I'm sure this stuff has changed because it's changing slightly already, the cold chain storage, so we can transfer it once. So if I take frozen vaccine out of our freezer and bring it to the clinic site and thaw it out, I'm not really supposed to bring it back to my office thawed out. But we really want to make sure that we're moving it just one direction and have enough of it moving in one direction so we don't waste it.
Yeah.
Jim, did you say that the ethylene glycol is in the vial? Is that what you said? Did I understand you correctly?
Propylene glycol?
Oh, propylene. Oh, good. I was a little worried about not Scott. I was a little worried about it. I just
that's why they can keep it frozen and not have it.
No, I do understand. I just thought you said ethylene glycol. I'm trying to picture Scott, 15 minutes wondering why he's, not here anymore. I don't know why, Scott, I'm picking on you. I just picture you being first.
He's the first responder in the meeting.
Yeah. I hope you get it soon, Scott. Seriously.
Yeah.
I'm glad to see that.
Guinea pig here. Yeah. No.
And any other questions on that information?
I have just a gossipy question. What was up with that pharmacist that left it out intentionally?
I haven't had a chance to read that story. I don't know why somebody would do that. But I was on a public health call today. Yeah. We got notification that our vaccine order was approved Monday afternoon. Tuesday, the truck was here. No notification it was coming. The truck was here. Mm-hmm. And it's like, oh my God, I'm glad we were here. We had one health department where that happened. And fortunately, somebody, and it was a place where the town hall was closed, but somebody came in and saw the box there and called the health agent and said, hey, you got a box here that says cold, so come put it in the fridge. So we're a little concerned about how quickly they send that when they send it. So,
wow.
Yeah.
Wow.
So
that's good.
Question, you gotta unmute fully.
I know. Once it defrosts,
yep.
Can you keep it in the refrigerator?
So again, because we've transported it there, we need to use it there once it's thawed out.
Okay.
You can take a vial, thaw it out, and keep it in the fridge for 30 days, as long as you haven't punctured it. Once it's at room temperature, it's 12 hours you got to use it. Once you puncture it, it's 5 hours you got to use it.
Wow.
So we're going to have somebody, again, managing how those vials are handled so that we don't screw it up. I think of all of this, that's given us the most indigestion, is making sure we do this right. Not that we can't, it's just that it's new. It's not a flu vaccine. And you can't shake it because it's delicate. It can swirl.
Wow. Very sensitive.
Yeah. Don't know.
And fire and police getting it?
Yep.
Okay.
Both fire and police. Everybody has submitted their count to Jim, pretty much for the entire district.
Awesome.
Everybody that was interested in it or may have initially were very leery on it and had flip their choice in the you know, a couple days after that. But you know, a lot of people are on the fence, but they seem to be changing in favor of getting it as it gets closer.
And hopefully one of the things, once more people have gotten it, like in your department, more people will say, all right, they didn't die, they didn't have reactions, they didn't grow an extra limb, they didn't, and feel more comfortable with it.
Yep.
Right. And they've been giving it in Europe for at least a month now, right? And a lot of healthcare providers have already had their second dose. So there's proof.
Yeah, I've been talking to several people that have begun receiving their second dose in the last week and a half. And some people do have a reaction to the second dose. And some haven't had any reaction at all. So it's just, you know, this is just my personal take on it. And it appears that in some cases it's similar reactions to receiving the flu shot. But I guess, you know, we'll see more of that and see how it goes in time.
Make sure you post it on your Facebook page, Scott.
Yeah, I'll have to have somebody do that. I'll have to have somebody do that.
Yeah. You don't have to, not pictures, not necessarily pictures, but that you guys are finally getting it. So.
Yep. Oh, yeah, absolutely. Absolutely.
Where's the clinic going to be?
So for our clinic will be at the Boxborough Regency. They're going to allow us to use the banquet room. So we walked it today. It's a huge room. It's great for kind of channeling people in and out of. We did the flu clinic for Boxborough there this year. So we know in 4 hours we ran a couple hundred people through it. So and that included, you know, children who really weren't happy to be there. So we're hoping that first responders will come with their sleeve rolled up and just sit down and take it.
Oh boy.
Well, if I can help at all, Jim, please
I will
call
certainly
me.
let you know. Absolutely.
Me as well. I'll be glad to help out.
Okay.
Yeah, we can direct traffic, right, Louise?
Yes, we can.
Never had any experience, but sure, why not? That's right.
Yeah.
Okay. Anybody have any other questions for Jim or Scott about the COVID-19 update before we move on?
So if you, Jim, if you get vaccinated twice, does it mean you don't have to wear the mask no more?
No. Right now they're recommending, and because we won't have herd immunity. And one of the things, and I haven't heard, maybe Mike, you could speak to this because you seem to have, is they don't. They know that it's 94%, whatever, it protects the individual. It doesn't necessarily mean that you may not be a carrier. And again, Mike, please correct me if I'm not. So that spread of it, they're not sure that it prevents people from spreading it, just people from getting it.
But the only thing I carry is cookies.
Yeah, you still need a mask.
I still have to have the mask. Okay.
You do.
All right. For how long? Until everybody's got it?
I would say until we've got a fair amount of the population vaccinated.
I got it. Okay.
I think
Thank you, Jimmy.
Jim's got the facts. We don't know whether or not once you're vaccinated and you can have a mild invasion and be a carrier. And we don't know how long and how many.
I only carry cookies. So
well, we're talking about the disease carrier.
Even if you've had COVID and you have some immunities, you should have the shot, correct?
They still recommend, yes.
Yeah.
Great. Anything else, Kevin, Mike? Anything else to add? The questions to ask?
Yeah, this is still on COVID. So, has there been any further activity on the part of the state about supporting, encouraging, providing any sort of assistance to organizations, towns that want to institute a testing program, especially in the schools?
I have not heard that on any of my public health calls. Recently, everything's vaccinations now. Okay.
Yeah, and I'm sorry, Mike, I forgot to get in touch with Anthony because he said 4th he was going to, you guys will hear me? Around the 4th he was going to have a meeting with the testing people. So maybe Corey has something she can add to that.
I haven't heard anything.
Okay. All right. I'll get in touch. I'll email him tomorrow and see if he's made any progress contacting them, meeting with them. I know that the kids were going remote this week too. So. All right. Sorry, I lost my camera. Anything else to ask?
Thank you for the information. Thank you.
Yep. All right. Katrina, did you want to let us know what's going on?
I don't know. Jim did a great job. I was just thinking all of the vaccine questions you guys had are definitely good things for us to maybe educate the population about, or our community about when it gets closer. An opportunity for our educational piece anyway. All right, I am assuming you can see my slides.
Yes.
Awesome. So yes, Jim mentioned the big hiccup of the week has been that the state changed the dashboard presentation. It's interactive in that you can change the time period that you're looking at. You can look at the whole time, or you can kind of zoom in on a time frame that you are interested in. It does contain all the same data. It's just not in the same places, which has made it a little hard to find what you need sometimes. But I'm getting more familiar with it, which is great. So this is the landing page. This is today's data for the state. So there were 6,419 confirmed cases reported today. They're also breaking out much more clearly the probable cases, which is 432. There's this whole definition of what makes a probable case, and actually it's more likely to be a true case, and they'll just follow up with PCR testing.
6,000.
So anyway, 6,400 cases, or a little bit more. Today actually marks the first time when you look at this cases by age group over the last 2 weeks. This week marks the first time that the 0 to 19 age group surpasses the 20 to 29 age groups. Over the last 2 weeks, we've had this big catching up of the numbers. The counts in all age groups except 20 to 29 are kind of catching up to the 20 to 29s, which is interesting. But unfortunately, our youngest age group is now the top. They're in first place, you could say, which is not a good place to be. So the second page of the dashboard gives you just the snapshot of the trends. I actually truncated this from the beginning of November to the current date. So you're seeing 2 months of data. It's a little hard to read when you look back through March. You can see that everything's trending upwards: test positivity, hospitalizations, and deaths. There is a lot of instability in the number of cases diagnosed in the last week and a half, and I will go into that in the next couple slides. So this is, on the left, is the number of confirmed cases. Again, the time period is November and December. And you can see the trend line. This is Thanksgiving right here, this low part. And we had the increase right after Thanksgiving. And then we kind of leveled out of the state for 2.5 weeks or so. And then we had a low point, which was Christmas, when no testing was happening. And then we had the sharp upward trend. And the data is probably complete till about here. So this end of the curve coming down isn't that the trend's decreasing, it's that we just don't have all the data reported yet. Because there was 2 holidays over this 1.5 week period, it really impacted the reporting time and also just the number of tests being done. So we have a little bit of catch up that needs to happen. On the right side is the test positivity for the entire state. So let's see here. So if you look at it again, like this was Thanksgiving right here. And then we had this sharp upward increase and we plateaued for a few weeks. And this is actually Christmas. And we had a sharp upward increase. And then this end of the data again is just lagging. We don't know what's happening right now because there's delays in reporting. This is the beginning of this year, which is there has not been enough time to incorporate the data yet. So at this point, we can say that after Christmas, there was an increase in test positivity, much like we saw after Thanksgiving. Also a concern, when we hit this pause, we never came back down to Thanksgiving levels. So we kind of just leveled off. So now anything that happened over the holidays is just an increase of time. And remember that like the 5% mark, positivity mark, is where the experts are kind of saying you want to keep it 5% or below to help prevent spread. So anything above 5% is suggests there's a higher level of transmission, and we are now 8.25%. So this combines two things. This is that rate per 100,000 by age group chart that I do update every Thursday. You can see that the data ended on the day after Christmas. And we had this like pause where the rates kind of went down. And then we've had this, I don't think these actually went down. I think this is the depression in the number of tests preceding Christmas, or the Christmas testing, which didn't really happen that much. So my guess is that once the data catches up, we're going to find these go right back up. So we'll have this little dip with the holiday, and then it will end up back up. The other thing that's on the dashboard now, on the first on the state's daily dashboard, is you can look at test positivity by age group on a daily basis now. And our 20 to 29-year-olds have an 18.7% test positivity, 0 to 19 have 17.6%. Basically, remember how I just said 5% is that threshold that most experts would really like us to keep our test positivity under. And we are, in many age groups, 3 times that level. So this is concerning. The good news is that there are fewer 80-year-olds. they're under the 5%. But again, these are all growing every day for each age group. So anyone 0 to 59, we're having we have a high test positivity, not only above the 5%, but also above the 10%, which everyone uses as like a definite threshold cut point. So this is the number of tests by date. And you can see that we're fairly steady. We had a little ramp up right before Thanksgiving. And then there was the decrease in testing during Thanksgiving weekend. That happens every holiday weekend. And we came back up slightly lower levels, but still pretty good. And then we hit Christmas. And again, there's a decrease in the number of tests, but there was also a decrease in the number of tests preceding the New Year's Eve holiday. So this week period has 2 holidays in it, which really, I think, impacted the amount of testing that was happening. So that will impact the number of cases being identified. So I think over the next week or so, there'll be more catch-up testing, and more people will be caught once testing kind of ramps back up again. So this is not that we have fewer tests right now than we used to, and where the data covers right now. So this is, again, the last 2 months. Hospitalizations are on the right. It just keeps steadily increasing. We're now, most days are over 2,000 hospitalizations reported each day. And it does, on the dashboard, say that 86% of hospital beds and 75% of ICU beds are currently occupied. So there's not much more above that for extra people who might be needing hospital services soon. And these are deaths. Deaths continue. These are the confirmed cases, and these are the probable cases. But confirmed cases of death continue to rise as well. At the beginning of November, remember, we were about 20 reported deaths a day, and now we're 60 reported deaths a day. So both of these are not great indicators of what's happening. The other thing that comes out in the weekly report is this report about how contact tracing is going in the state. And they actually changed the categories last week, so I can't directly compare to see if there's been an improvement. But when you add up the never reached, the not yet reached, and the lost to follow-up group, we have about 30% of all cases we don't have information on what happened, or what they weren't reached to get told to get testing or quarantine or anything like that. So that's a large chunk of cases, especially, if you're talking, I don't remember how many were in this week. 41,000 cases. So if you're saying 30% were not reached or could not be followed up with, that's a problem. I'm hoping this isn't Jim's experience locally, but something, again, that if we can get people to answer the phone, it would be great. So then I need to zoom in on the Littleton data. And I, just like you guys, just found out about the 46 cases. from today. So this is the graph through last week, what Jim had provided to you guys last week. So we'll add 46. So we're slightly higher than where we have been for the last 2 weeks. And then this is, again, current through last week. This is for the 2-week period ending December 26th. We had 39 cases. We kind of held at 39 cases for 2 weeks in a row. So we already know that this is going to be higher tomorrow, slightly higher. We'll still be in the red. We've been in the red for 6 weeks now. And again, keep in mind that with the 2 holidays and the lower levels of testing, I expect that Littleton had lower testing levels too. So we're probably missing some cases that would have been caught otherwise had it not been a holiday week. Again, this data is from the weekly report that came out last Thursday for the data period covering December 13th to 26th. So this actually shows us the experience here in Littleton before Christmas or right up through the day after Christmas.
Red, huh?
Yeah, so we are still red for 6 weeks. We had 39 cases. This rate was lower compared to the 2 weeks prior when we were at our peak, which was 58 cases, I believe. But our border communities, those that we share a border with, were a little higher actually, and their rate was higher from us. I'm assuming this was driven by Shirley's outbreak at the Devons federal penitentiary place. But actually, when I took it out of there, it didn't really change the rate much. So it's not just that driving this higher. And then everything kind of lowered just slightly for this last week. But again, everything's still in the red. So it doesn't, while it's slightly lower, that pause that I was talking about after that Thanksgiving surge, we kind of hit a pause. And now we hit tomorrow's report will cover the week. We'll include the week before and after Christmas. So we'll start to see that glimpse of what Christmas did. So this is the graph of the trend lines for the same data I just showed you. And again, like we hit that kind of slightly lower after. This is the Thanksgiving surge here. This is Littleton. This is the Thanksgiving surge. And then we lowered and kind of held. So tomorrow's report will be telling about where we are and where the state's going to go. All right, so this is the test positivity. And again, it pretty much held steady. It's like slightly lower or slightly higher, depending on which grouping you're looking at. But our current positivity was 3.68%, and the number of tests was almost exact compared to the 2 weeks prior. So there wasn't an increase of testing happening leading up to Christmas. And then again, the graph of all of this, you can see that we had a sharp increase right after Thanksgiving, and then our test positivity came back down. Not completely down to the same level, but it came back down and held somewhat steady. So we'll see where we are tomorrow. And then I'm going to end on, this is my Littleton from the entire experience of the entire pandemic. So this is starting back we had town level data starting in April. And this is the graph of the number of new cases by week. And you can see that we were doing great in the summer, and now everything just kind of steadily started increasing. And this 2-week period was the weeks after Thanksgiving, and we came back down, but that's still higher than at any other point in time preceding us. So at this point, there is more COVID in our community than there has been at any other point prior to this. So we need to find ways to help slow the spread in our town. Now here's the cheese. You guys know all this. We have vaccines starting to roll out. That's a great layer of cheese to have, but it's not going to be available to most of us. So, that masks and everything we need to keep using. So one thing I do want to mention is that over the holidays, news broke that there's been a couple new variants of the virus circulating worldwide. There's one that's being referred to as the UK variant, which appears to increase transmissibility by 40 to 80%. So, they were saying before that COVID was transmitted to, and on average, 2.5 people, like one person would give it to 2.5 people or 2 to 3 people. before, give it on there, and then they would give it to 2.5 people. But if this new variant is the one that starts taking over and like circulating more, then that means that each case will start giving COVID to a little over 3 people, 2 to 3, or 3 to a little over 3 people each, which would really increase the transmission and spread of COVID rapidly. It's also been suggested in that same variant is more contagious in kids. And that variant, the UK variant, is here in the United States. I've seen reports of it being present or being found in at least 5 states so far. And none of those individuals who had that variant of the new variant, UK variant, had a travel history. So it's been circulating in the United States, and those states aren't next to each other. So we can pretty much assume that it's everywhere. The closest state to us has been New York, so it's not far. So the more that SARS-CoV-2 or COVID circulates, the more chances it has to mutate. So we got the vaccines, they're coming at us. If we can do anything we can to slow the spread, then we're kind of limiting its chance to mutate and make it harder for our interventions to work. And so just to keep going, that it's those collective daily decisions to wear masks, to wash our hands, to keep our distance, to avoid crowded situations as much as possible. Those will all help reduce transmission. And one thing about the vaccines, Jim did a great review of everything I know and what the governor has stated earlier this week, but I believe there's going to start rolling out information about how much vaccine we received in the state and how much has been administered so far. So that should start coming out into the Thursday's weekly report. So hopefully we'll have some information next week. So we were just talking about chains of transmission, right? So I was just saying that if one person spreads it to 2 people, if you can break that chain and spread to fewer, hopefully none, but at least 1 versus 2, then you can really prevent a lot of cases. So all of these, if each person only transmits to 1 person because you've broken this chain of transmission, then you can really prevent a lot of cases from happening, and that would really slow the spread. So that's what we really hoping that people can stay home as much as possible right now and make sure you're masking up and all of those things, those layers of cheese we know work, get tested, things like that will really help to prevent spread and break those chains of transmission. And given that new UK variant coming around, this is even more important so that it doesn't spread further more quickly. So I know we've talked about this a lot, that household transmissions is one of the main ways COVID spreads, and because we're sharing air in our house and we're not masked and we're close to people. So it's really important for our communities that you stay home and seek testing if someone in your household has symptoms, and also if someone in your household has a known exposure, and that way you can catch spread early or before it can happen, and that will help protect our community. It breaks that chain of transmission again. And there are ways to prevent or try to reduce the risk of transmission if you live in the same household, that by like isolating the sick individual or exposed individual in a separate bedroom or bathroom until you know whether they test positive or not. Everyone can wear a mask in the common areas that you share, open a window, doors, just to help increase your ventilation, clean your surfaces and your hands, and consider yourself quarantined too by not going out into the community to help protect our community. And definitely if someone in your household is at higher risk for severe outcomes because they have comorbidities or whatnot, it's really advisable to put them in a separate space to protect them if you can. And then one of the recommendations I've seen from multiple public health experts over the last few days is to check your mask again, the quality of the material that it's made out of and the fit of it on your face. So they're saying with the higher levels of transmission to really make sure that that mask fits well. And that's more important than ever now. So a multi-layer mask, ideally 3 layers is best, 3 or more layers. It needs to be well fitted. It needs to seal well on your nose and your cheeks and your chins. I know a lot of them don't seal well on your cheeks. So like trying to adjust it to fit your face better. And it definitely should be worn over your nose, your cheeks, and your chin just to create that seal. And I I also was reading that masks that tie around your head and your neck actually seal better than many of the ones with the ear straps. And that's just because it holds it tighter to your face. I know some people can't tolerate that, and I would rather they wear a mask than that, but just adjust your ear strap so it doesn't slip down. It slips down less. And then if your mask, a lot of them have an ability to slide in a filter pocket. That might be a great idea to add a layer to your mask these days, if it's possible. So we know that we've been wearing, here's another thing. We've been wearing masks for months, and it's a really good idea now to just look at the masks that you wear and reuse and see if there's any wear and tear of them. I actually looked at my kids' masks over the break and realized that they were showing their use with the masks they wear to school. So we're actually replacing those. So just some good ideas to decrease your transmission risk, yourself and others. And that's all I have today.
I just have a couple of questions, Katrina, and I'll ask them both so you can. You have these probable cases now, and then the new variant is the test being specific for which type of COVID that you have, or is it the US COVID or the UK COVID?
Those are really great questions. Let me find. So the state defines probable cases. The probable cases have always been in the report. They've been kind of buried. So they define, and the probable case definition is actually nationwide, not just here in Massachusetts. So it's consistent across all states. So a probable case is a person defined as meeting one of the following criteria. They either have a positive antigen test, or they have COVID symptoms plus a known exposure to a COVID positive person, or 3, they've died and the death certificate lists COVID as a cause of death. My understanding is that's low in terms of what gets someone on probable. And when I talk to my friends, and then some of these individuals who are probable will end up following up with a PCR test. So the molecular test will end up being moved to confirmed. So often it's like if someone is doing a rapid screening, some of the schools use rapid screening or workplaces do, and they get a positive, then they go send them to get a PCR test to follow up. And so they'll start as a probable and end up as positive, confirmed later on in the report. It just takes a little more time.
So it's not necessarily deceased people or anything like that. That's one part of them. One part of
It's one of the definitions they're using, but it's my understanding that that's by the time you kind of die, you've already been in the hospital and you've had another test, so you've already gotten into the other bucket already. Okay. So the variant piece is interesting. So it's not routine here in the US to test strains or the genetic code of all the tests. And I think it started to happen in some states more frequently now that they knew there are variants around. But it's not a routine thing to do. So I don't think if you went in to find out if here I'm doing my COVID test and I'm positive, I doubt that it's not going to tell you if you have which variant you have. I just know that it's circulating, and at what level here in the US, we don't know yet as a prevalence.
It doesn't matter if you isolate, you wear a mask, and you try.
And the ways to reduce transmission of it is the same as with the old COVID, if you will, which is not the way to say that, but
US COVID.
The original COVID and then the variant is the same. Behavior should happen to help reduce transmission risk.
Yeah. Anybody have questions? Mike, Kevin, Louise, or Gino?
So far, as long as we decrease the cases, it's beautiful.
Uh-oh. I lost Gino.
While we wait for Gino to come back, anybody else have a question?
Yeah, is he back?
Oh, Gino, you back? Oh,
pardon me?
Kiss him a call.
I missed you, Gino. Can you say your question again?
Well, as long as the cases decreases, and everybody, like you say, they wear the mask, wash their hands. I usually put plastic gloves on. You know what I mean? So if I touch a door, sometimes they're black gloves, plastic or white. And then you wash the gloves too, you know what I mean? And then a couple of days you throw them away and put another pair on.
Yeah, gloves aren't really a great idea, Gino, because it takes a lot. I mean, you really have to know how to, it's called hand and glove hygiene. So gloves are not always great to use. So
the only time I use the rubber glove is when I get gas and when I open the door to go
and
into
then throw it away. Don't wash them.
Then I throw it away. I only use it once.
Good. All right. Anybody else?
Yeah.
Thank you for the suggestion.
Yeah.
Yeah, I have a question for Katrina. I'm looking for actionable items from your presentation, and the one that comes to me, which has been coming to me since a year ago, is of all the things that we can do, I take it testing, other than what Gino has just recited. How much would testing help us break the chain of transmission and, shall we say, suppress, not eliminate, but suppress at least some of these surges or post-holiday surges we see?
That's probably.
Is there any, what do you call, I'm thinking of other SARS pandemics, or they weren't pandemics, epidemics. There have been other viral, diseases spread fairly rapidly through populations, and there were methods brought in to suppress. So my question is that what kind of an impact would that have as an actionable item, that we know that from experience as opposed to theoretical?
So I think, one, that's an awesome question. And that is the missing layer of cheese, if you will, here in Littleton, especially. And so when you look at the college, the use of testing in the colleges, you remember that line which unfortunately I couldn't find the graph on the new dashboard, but the line that just stayed steady right at the bottom of the test positivity graph. And then the rates for the rest of the state is just going upward. So the benefit of, especially with something like COVID that transmits, it spreads before people know they're sick, before they know they have it, that asymptomatic or pre-symptomatic period. Something like a routine test where you're testing, for example, a student or a staff member once a week, you're more likely to catch them in the earlier side of the infection and before they have a chance to spread to someone else. So you're really, this is where that image I just showed, I'm going to put it up again. That's where you can really break that chain of transmission by testing early. So if you test early, there's this case before they spread to 2 people, you caught them early and you stopped them from spreading to this person, who then doesn't spread to 2 people and the next 2 people and the next 2 people. So it would really help to prevent spread in everywhere if there was more rapid testing happening.
Okay, so we're now all waiting anxiously for the priority listings and the administration of the vaccine.
Yep.
So getting back to your graph, that depiction that you just had, okay, and the what I call the Scott and Jim show that's coming up, okay. There's not enough of them to do a real epidemiological analysis. Is that correct?
Yes, true.
Okay. How large a population would you need in order to address the question from vaccine to, we'll say, as long as it's not generally available, which would be at least through this phase and maybe through the next one coming, whatever that is, when you eliminate the people with comorbidities and the people over 75, they're included in the next gang going in. Okay. So how valuable would be, what concerns me, to cut to the chase, is that during the phasing, we're leaving the bulk of the population, that is, if you put up your graphs about infectivity, you are in fact leaving a large population very vulnerable to the disease.
Yes.
Okay.
And you're leaving a large population in a group setting vulnerable.
That is correct. especially.
Yes.
So I'm not against priorities, and I do understand all of that. It seems to me to be, it's almost as if we're saying we do not have the ability or the amounts of material to vaccinate everybody in an orderly fashion. Forget priorities. I have no problem with Scott and Jim and folks who are front facing to get it right away. That's not an issue here.
Right.
But what concerns me is whether or not the vaccine, this plan of phasing, for whatever reason, why we can't produce enough vaccine for the population to go at the rate we need to, because according to what you're presenting, and I've seen it in other epidemiological analysis, we're just, we're not really going to be able to cut the death rate. I want to cut right to the chase. We're not cutting the death rate.
True. Yeah, we can't, at this point, vaccine is not either being produced or delivered quickly enough to actually reduce transmission.
Okay, I can assure you, it's being produced in great quantity, and it's the last mile. Anyway,
I wasn't going to go there, but yeah, it's the last mile. It's getting it into people.
This has been watched from the beginning. I just, both testing from the, just repeating myself. So let's be clear, actionable items coming from the kind of analysis that you're doing and others are doing, it's very clear to me that we're vulnerable.
Yes. Yes. And actually, it's concerning to me that the number of cases by age group is now highest among the 0 to 19 group. That's a school-aged population. And knowing that household spread is one of the highest drivers of cases, a kid gets it in school and they bring it home to a family, even if the family is working from home and not going out anywhere, and the only thing they're doing is school, you're still introducing it into a household. And those are large settings with lots of people who spend a lot of time together, and we're indoors and the windows are shut and there's just more COVID everywhere. Testing is the one thing I think that can complement the vaccine drive and actually it would help enhance the vaccine effectiveness because you're reducing the number of cases in the community. So if we could do a lot of testing, surveillance testing, routine ongoing testing, and then also the vaccine, you're giving you don't have to vaccinate as many people at that point if the COVID's not circulating as much in order to suppress it with the vaccine. So they actually work together really importantly. And if we could introduce testing into our schools, it would be amazing. And it would impact the families at home. It's not just the people in the school. You're impacting the households that those kids go home to. We're impacting the other people that the adults that come in contact with. We're really impacting, you're breaking that chain of transmission so that we're really preventing spread for the entire community.
So it seems like for us, the Board of Health, it seems like the only actionable item we have in front of us is continuing talking about the the layers of cheese, but maybe we ought to we should hit harder on testing. Yes,
I think the testing layer of cheese probably has fewer holes going through it. It's a more efficient tool in our toolbox if we can get that moving.
I'm emailing Anthony right now.
Thank you. Yeah, I mean, you guys, I can keep coming here every week and saying, wear your mask and wash your hands and keep your distance and making it an individual choice to do that. But honestly, the testing thing and vaccines are coming and they're coming out in a way that's been prioritized by people. We don't have control over that. And that's okay. Like the frontline people should be getting it first. The long-term care centers should be getting it first. I'm fine with that. Hopefully teachers are included in the next round. That'd be great, but, or, public employees, things like that would be amazing. And grocery workers, things like that would really help prevent cases among those essential settings. But yeah, testing also helps drive your cases down. I know it seems like you're going to test, you're going to find more cases. You will initially probably identify the cases, and then you'll start breaking those chains of transmission, and it will drive the number of cases down over a short period of time. And I don't think you need 100% participation in testing in order to see the benefit. I saw a model the other day with just 50% transmission, and it drove the model down in a couple 8 weeks or something, like 2 months. You could have a much more lower steady level. So I think it's really important right now. And to wait right now, to delay it to getting started is one of the worst things we could do right now when we're at a really crucial time.
Yep.
That's my soapbox.
All right. Thank you, Katrina. Anybody else have any questions for Katrina, Louise?
I don't know if it's for Katrina or Mike, actually, but this is just a technical question. When you get the vaccination, how long does it take to protect you? You know what I mean? Like, is there a waiting period, or?
You mean how long your immune response starts up to protect you?
Yeah.
The reports I read is that it's a couple of days, but it varies from individual to individual.
Yeah.
And also it depends on what antibodies you're already making that are close enough in relationship to the coronavirus, because that means that you have T cells, or I'm getting into the weeds, but your body can already recognize close relatives. And so it makes it a little easier for your immune system to manipulate itself to respond. So it's all over the map, but it's a couple of days before you have some sort of protection. But you got to go for both shots, because there's a reason why Moderna and the others or I think Moderna is hitting for 2. There's a reason why they want you to take it twice, to make sure you have it's a longevity as well. So you gotta keep wearing your mask and be careful. You just can't go out and party.
Once you get the shot, you just can't
the only
live
people,
normally.
The only people who can wear their mask and go out and party are people who have cases of already recovered from their cases of COVID and have shown serologically they're making antibody against their COVID, and they get their vaccine. Maybe they can party while they're wearing their mask.
So I would argue that as an individual, they can party without wearing their mask, but they still may transmit it to somebody else, if a mild case that they don't know about.
No. Before a vaccine, I wouldn't send anybody out.
Yeah. So there's the individual. We're protecting individuals with a vaccine right now. We don't know if that protects the community level. And it's really important that everyone, regardless of vaccination status, continues to use the proper public health precautions.
Do you have to do that every year, or just one time, twice?
We don't know.
Well, that's what my question was. We take every year, we go for the cold, when you have, you know what I mean?
The flu shot, yeah.
Yeah, for the flu shot every year. And
we might have to do that again.
Yeah, will there be like a second time that you have to go? Or?
My strong suspicion is yes. My suspicion is it'll be a while before we can talk about not getting a shot pretty frequently.
I got it.
And the big advantage for this guy, though, is because this virus reveals itself. The flu virus is when you get the vaccine for the flu, it's for last year's strain, and it's a sort of a guess about this year's strain. But with this virus, we're going to know its sequence pretty fast, because it infects. Okay, and we were able to basically, and the technology now allows us to make batches of the vaccine in greater quantity faster. So we'll be at a slight advantage if this thing changes, which it will.
So I just looked it up too, and it takes a couple weeks to build immunity, not just a couple days. So it's actually longer from that first shot.
To what? To get full protection?
To have enough protection, yeah. To build the protection.
Oh, I thought you were asking whether or not your body responds, because I was talking about
your body starts responding immediately, but it takes a couple of weeks to build enough.
Oh boy, let's see what happens.
Okay, any other questions or comments for Katrina?
Thank you, Katrina. You did a good job.
Thank you, Gina.
She always does. All right. Corey, John, or Kevin, do you guys have anything that you want to add?
I think it was all covered. Thanks so much.
No, I'm good. Nothing else. Thank you. So I have one item. So Harvard, the town of Harvard, had set up an agreement with, I believe it was CIC, to do a one-time screening for all the staff and students, and that was supposed to occur on Monday, the 4th. But I guess because of the inclement weather, they had to move it to yesterday. And what they ended up doing was a drive-through testing plan. And the idea was to have cancel school for the day and have the students and staff come in and get tested. And they ended up having 713 individuals come in to have tested, which is about, Liz estimates, about 70% of their their staff hybrid student population through this drive-through testing. They don't have the data just yet. They're waiting for the results, which should be coming in at some point tonight. But they were able to get testing in place to have that one-time testing. And they, in terms of the funding, they've received donations to enable this testing program to last for about 4 weeks, possibly 5. So they're going to keep doing this. I'm not sure how frequent, but at least they have some money to continue on. I haven't heard anything from Anthony, and I think Mike Fontanella emailed me mentioning that they're still working on trying to put the survey thing together. So that's all I know at the moment.
I just emailed him and told him that the 0 to 19 group is the highest group now, according to Katrina's presentation. So we got to move on, get moving.
Well, here's a thought to I guess for this board to consider. I realize that Mike and the school committee are trying to address this as to trying to address the survey more geared towards the staff and the parents of the students. But would it be the board's interest to just try and get a gauge from the general town's consensus, get a survey out to the town itself just to see what people's level of interest would be, and whether they, we could have funding, separate from the school or whatnot. Because if there's issues with trying to get something out to the families for just the school testing, what's stopping this board from going out to the town, the community itself, to get that query out?
So asking the town if they'd be willing to participate in testing themselves, or funding the school testing.
Well, I guess you could look at it in layers, like we discussed before, of what's your level of interest in testing in general, and would you be, the second question, would you be willing to contribute towards testing? Because as Katrina's pointed out, we're seeing a lot of, it's in the community. So not only for people who have kids in the school, but people who work in town or whatever else, there might be interest to have, hey, if I don't have to wait 4.5 hours in Lawrence to get tested, I can have, get tested in a program provided by in Littleton. That might draw interest. So it's just something to consider.
I think the longer. I'm sorry, Jim, you were suggesting that the town should immediately poll the town. In other words, a sort of a general town survey.
Mm-hmm. Yes.
That would put sort of the generic question to the town as a whole of the level of interest in having testing. Is that the idea? And then if it's large enough, like 50 or 60% of the respondents say yes, I don't know how large the number of respondents would be, that would be linked to yes, we're willing to pay more, or do it. Basically, each household or each individual would say yes, I can afford the $10 for the test. Is that basically the idea? To poll first?
Yep.
Poll the town first.
Poll town first, because if we find that you have less than 50% interest, right, then that tells you there. But I think Mike Fontanella would still continue on with trying to get the survey for the amongst the families there, because it might be different groups that respond, but at least you get the ball rolling. Because at this point, the concern is, are the companies that are offering the testing, are these slots getting filled? And you're going to come to a point where there's not going to be any more availability to have the testing done. So I think we're reaching a point where critical activities need to be pursued. and it's just something to consider.
Yeah. John, one further point, since you're in touch with the folks at Harvard, Liz, who's doing this, has there been any reports back, positive or negative, about staff support by the town itself? Like, for example, are the school nurses being unusually burdened?
I don't know. I can inquire with her, but I don't know that answer offhand.
I know right now the nurses are extremely busy just following up on kids who aren't in school, or their parents have said they're staying home remote because they have a cough or whatever. And they're busy following up with each student who either has symptoms or is tested positive or has been in contact with someone else outside of the community or even inside the community. They're busy right now. So it might be that we have a rough couple of weeks with the initial testing as we identify the cases, and then when they start dropping, they'll have less work over time.
I guess I'm confused, John. Are we talking about testing students and staff, or are we talking about anybody in town that wants to be tested?
Anybody.
I think so. I guess to this board, I'm making the recommendation that maybe we look at it for community testing. For Mike, what the purposes that Mike's trying to do, it's going to be geared, targeting more of the staff and students. So the survey that, I guess he and his and the school committee are trying to put together are going to be geared towards sending out to the families to get their level of interest. So for here, for the Board of Health, it might be worthwhile to consider putting out a survey that's more broader as compared to what Mike Fontanella is trying to put together, just to get to gauge the interest within the community. And so this way you can start moving forward, that if there is a great deal of interest, that you can start contacting, I guess, the potential vendors and seeing what can be done, because there is a lag between, all right, we have definite interest in this, and then trying to get something in place. So there is going to be, you're looking at multiple weeks to try and even get something like this started. So going from Liz's example, it took a couple weeks to get to the point where she was able to get people tested yesterday. So what I'm saying is it might be worthwhile to consider starting this process sooner rather than later, because one, it's going to take a while, and two, who knows how many spots are going to be available in the upcoming weeks if this trend continues.
Right. The Wellesley group, was that just testing for schools, or was
they were just testing? There are several communities that are doing. Wellesley is just testing the schools, I believe. Brookline is doing a general community testing, and they're using an office, a spot in their town hall. There's a bunch of other towns that are doing, I guess, a mix of the two. I have to dig through some of the notes, but I guess the point is, we're reaching a point where it's starting to creep up in all the communities, and I think it's just worthwhile to gauge, what the interest is within the town.
Sure, and I think, Jim, this might segue into an email that we've received from Joe Layton about setting up a testing site in Littleton. And I know Jim and Scott were on the email too. Did you guys get any more information at all from Joe Layton about that you know of?
I have not.
Okay. All right, I'll reach out to. All right.
Does this letter specifically refer to testing for the schools, or does it refer to testing in Littleton, or none of the above? Or testing testing for frontline workers?
No, it was an email from Town Hall asking for guidance regarding establishing a rapid testing site at Town Hall outside. So I was thinking that it might be one of the ones that the state is running, and people drive up from anywhere and get free testing. It doesn't seem that they've and I think Scott replied, but it doesn't seem that they've gotten anywhere with it. And the last thing was, all right, I'll get back to you. So
yeah, let us know.
Yeah, and who's going to staff it? Who's, I think our staff is probably spread pretty thin by just doing what they have to do.
Oh, so Lisa, there's, we're starting to see more examples from other towns where you don't necessarily need a large infrastructure to do this. So based on some of the examples that we've seen, such as Wellesley and Brookline, that we might be able to get away with something that doesn't need as much staff. You will definitely need a program manager, that's for sure, to help oversee all of this based on what we've seen before from the other towns. But there is a way, I think there is a way that this can be done. And if you have more buy-in from the community, that you'll have potentially more funding that will help support this. So unlike the situation in the schools where there's a balance of like how much can be allocated for the testing. If there is a large contingent of the town that wants to do this, then yeah, it might be possible to get this going.
All right. So are we thinking that we should probably go to select board too and see if they're interested in helping us with this?
I think so. So this is my opinion, and I'm speaking for myself. I don't think you need the select board. I think you can act on your own. I really don't think you need their permission. I don't think you need to hear from them. You just act, that this is a crisis right now, and you're just going to go and do this. You're just asking a question to the townsfolk. So I really don't see to have the back and forth with the select board to get their blessing to do this. But that's just me. That's me speaking. My view.
All right. Does anybody else have any comments or questions or anything?
You always check with the selectmen first.
Well, Gino, I think at this point we're looking at a critical period right now where we're seeing rates going up in the community, and we're also seeing a point where there's I don't know if you've seen the news, but the various testing sites, you're looking at long lines. So here, if we offer the community, the members of the town, an opportunity to get tested and be able to track what's going on, a surveillance within the town, I think that's that's just something that needs to be addressed right away. And so we can discuss this with the select board later on, or can be discussed with the select board later on.
But I understand what you're saying. The question is, if you approach the selectmen when they have a meeting, even on a Zoom, you can express your view, and I'm sure they will say, "I think it's a good idea."
Okay.
And they might be able to help us even financially. You never know.
I'm just talking about the survey, Gino.
Yeah, the survey.
Right now, I'm just talking about the survey.
Okay. But it's always a good idea to let them know.
Mike, did you have anything? Oh.
I think Kevin has. I think he's up.
Sorry.
Sorry.
No, I John, I really appreciate your comments. I tend to agree with you. I'm wondering if this board has an appetite to survey the townspeople to gauge the interest in some sort of community testing to suppress community spread and see if at that point, when those results come back, we can engage vendors and potentially develop a funding solution to get those tests implemented. I don't know where this board stands. I guess I'm interested to hear.
Yeah, I mean, I'm fine with it. I don't know how to start doing a survey, so I don't do it. That's what I'm asking. Do we need select board? Do we need the town administrator? Do we need Janet to help us with this? I mean, what do they have, like Survey Monkey or something like that? But I don't know how that works.
So, Mike, I think in the packet that was sent to both you and Mike Fontanella back early in December, that included the survey examples provided by the town of Wellesley, and I believe it might have been Somerville as well. There was another community in there. So we do have examples of surveys that were distributed to the school community, and those can be modified, or you could use the same thing because it's to the community, be adapted for this purpose.
Mm.
And then do you just email it to? Oh, how do you email it, or do you put it online?
Couldn't we just put it on our website?
Actually, Judy with LCTV has intimate knowledge of our email gun or blast system that we have. I'm sure she may be able to help us out with that.
Yeah, that'd be a good idea.
I have a question for Katrina. This is I'm not. This has nothing to do directly with the select board. It has to do with impact value, and that is that suppose the testing regime begins soon. Let's say before the end of January in the schools. Let's say that the school committee gets this act together, does the. I mean, it shouldn't take them that long. You're talking about, I think, a population of about 1,000. What impact would that have based on the analysis that you can do? What impact would that have just in our little town if we were able to cut the transmission links as a result of testing? What would your best guess be?
You're muted.
You're muted. You're muted.
I knew it was going to catch me sometime.
No, I'm trying to trick question here. I'm just.
Yeah, I'm trying to think it through mathematically. If you're reducing transmission by, it doesn't transmit to as many people, we're going to cut it in half and a half again and a half again. So then it will just keep bubbling up like it was in the summer, but then we'll come right back down.
Okay, John, I don't think there's any reason that we have to go to the select board to ask them to do a survey of interest to the Board of Health. It's a question of, do we have the resources? And I don't mean the pieces of paper and all the rest. I'm talking about the actual dollars to do the survey properly. So here's a question I'd like to raise. If we can get the school committee and Mike Fontanella to release their polling data and actually enter into a conversation where testing, shall we say, gets started by early February. Okay, just get that going. Do you think that would act like a helpful catalyst when the rest of the town sees it's going on, that the polling data that we were able to collect would justify the expense and the time to do more in town?
I think so.
So I'm thinking of the strategy of people becoming alert, because there is, shall we say, I wouldn't call it indifference. I would simply call it a kind of strange lethargy about responding to the numbers that everybody sees, or not everybody, everyone has a chance to see, not just at the Board of Health, but everywhere else. I mean, it's not a secret that our numbers are going up in Littleton and elsewhere. I mean, it's crystal clear. Yet you don't see a grassroots effort in this town, either from the select board or anyone, anyone other than coming from this board, to encourage the breaking of the chain of transmission. So I think the Harvard experience probably has helped maybe shake up the troops. But I think that the breaking the lethargy chain is going to be more difficult than simply putting out a poll. And I want to put out the poll, but I have no illusions.
No, I see your point, but I also believe you need to start somewhere. And I think
I agree with you. Yeah.
And I think there's within the community itself, if as compared to just targeting the schools, I think with the community you may have a better chance of reaching out. Because here you're not just targeting the families that have the students enrolled at the 4 schools, but now you can try and go to everybody, and you can also get Market Basket, the commercial entities in town involved, and because it would be worthwhile to them, because this is going to help them to stay open more. So there, I think if you think of it that way, that you get more of the businesses involved, to have them make their customers aware that, hey, the town is planning to do a survey to do on testing. I think you may gain better awareness of that. So that's just something to take into consideration. I'll go back into my notes and find out about what I think was Brookline, what they did, because they're the ones that doing the townwide, and how they took it, what approaches they took.
Yeah, there's also the whole issue of permission and transparency or lack thereof when you start involving the town government in sponsoring or supporting a town-wide effort. So that I'm just simply saying that these are the things that are contribute to the lethargy.
Mm. Yep.
Any excuse.
So let me put it this way. I forgot the individual's name, but he's our legal counsel, our town legal counsel. And he also happens to be the town legal counsel for the town of Wellesley. And I possibly think Brookline as well. So anything there in terms of what's done through the public, through the board, through the town government, Anthony, I believe his name, Anthony would be able to address those concerns.
Tom Harrington.
Tom Harrington is the attorney. Anthony is the town administrator.
I'm sorry, Tom.
Town administrator. Yep.
But I think he would be able to address some of the concerns that potential concerns that you're raising. And that's definitely something that needs to be visited. But I think, I guess the point that I'm trying to make is at some point we need to get the ball rolling either, through the school committee or possibly here. So that's pretty much it.
Okay. While we've been talking, I've texted Mike Fontanella and emailed Anthony. Anybody is there anybody else that I should talk to? Kevin?
Just a quick question. I guess I'd like to get the board's opinion on, should myself or any other member of this board be so inclined to sort of try and, spearhead an effort to put out a survey to the townspeople with, of course, board approval. Would that be something that the board would be open to listening to and taking a look at?
Yeah, speaking for myself, I would say yeah.
The town council, just so we can sort of just keep the ball rolling and not drop it, and not, every day we wait is just another day. It gets worse. So
another 5,000 cases a day, right?
Well, isn't it something we already have examples from other towns? Isn't it something that Janet can just edit? If I'm understanding it correctly,
she might be busy. I'd be inclined to take a look at like these Survey Monkeys and some of these other sort of systems that other towns have used and run it by, and have the board take a look at it and see if it's something that's acceptable in conjunction with town council to try and get it out there, sooner than later.
Or once again using the water department to contact people.
I honestly, I think we have the technology to get it in everybody's email box and get it up online and get it in front of people without, using snail mail and things that end up in the round file.
What were you going to say, Mike?
I'd say Mike Fontanella's had a copy of that survey, along with the school committee and the superintendent of schools have had that copy for over a month.
Yep. Yeah, Kevin, if you can do a little bit of legwork and see what Judy can do, and I'm fine. I think that, let's get our own survey going. We should. We're the ones that are looking at these numbers once a week.
I'll try and have something ready for our next meeting.
Okay.
Jim, I have a question for Jim. Is that all right, Madam Chairman?
Absolutely.
Jim, you've been listening into this discussion, I hope. Based on your experience up and down 4-9 in the district, what is your professional view of what we're discussing? Basically, community-wide testing, not versus, but school and community testing. Given the fact that we have mobility right now, what's your take on the usefulness of community-wide and school testing?
Well, the school testing piece of it seemed to be you're trying to keep the schools open. So having that school testing means you maybe catch things a little quicker, send people home. The community testing, it certainly would be more convenient because particularly during the holidays, we would get calls from people who are saying, hey, where can I get tested? The long lines, it took me this many hours to get tested. When we get questions about travel, the travel order and compliance with the travel order, we get the same kind of concerns that people like, where can I get tested to, to be able to try to comply with that. So it certainly would be more convenient for people if there were more testing sites more conveniently, but that somebody needs to run that. So to the extent that maybe you had a contractor that came to the town and ran that, that might be a good thing, but I don't know that even when I read the information on the BINEC stuff that was sent out to the schools, I think the school we're talking about possibly having to hire another person to actually be able to run that testing program. So it's labor intensive, it's detail intensive, and that's why if you were going to do it, I thought a contractor would be the way. I don't know if John was talking about the contractor for Harvard, but that to me seemed to be, if you're going to do it, the best and quickest way to have it done.
All right, so Kevin, if you can look into a survey and how to get it out to as many people. I'm going to talk to Mike and Anthony and Joe Layton tomorrow and see what we can get started, get this ball moving a little bit more. So, all right. Anything else anybody wants to talk about testing or? Thanks, John. You sound frustrated.
Just got home.
Yeah.
Okay. Anything else?
We have a hand in from the attendees.
Okay. Thanks, Dave. Can you state your name and your address, please?
Can you hear me? It's John Kurzwick, 171 Hartwell Avenue.
You're a little muffled.
Can you hear me now?
That's better.
Okay, sorry about that. Yeah, I didn't know if this is a public comment section. If you want me to wait till you guys get done with your agenda.
Is this about the COVID update?
Yeah. You want me to comment now or wait till you guys get done?
You have 3 minutes, John. Go ahead.
Okay, can you hear me?
Yep.
Okay.
I can hear you.
Okay, yeah. So related to just a quick point on the vaccines, I heard a couple of people talking about the vaccines. My recommendation for everybody on the board is for them to review the FDA briefing documents. They're only 57 pages long. They're publicly available. Just a quick highlight on those. The data from those trials does not show any reduction in all-cause mortality. And I think people correctly also said that transmission is not prevented. There's no data showing transmission. So it's important that the board get up to speed on that, especially if they're going to be making recommendations to the public. A point about the testing, I heard a lot about the testing. My question on that is, why are we focused so much on active infections? It seems like what we should do is get some testing data on immunity within the community. That would be a great number to have. If you guys recall, back in March, April, a Chelsea seroprevalence test showed 32% had antibodies. So it would be great to know if maybe we have a similar level of immunity. And then the other thing is, I did not have a chance to fire off this email to the board before this meeting, but one of the issues I have with the presentations that are being given is related to the cases. The case data is now completely decoupled from ICU admissions and mortality. And I can't go through all the details in this short time, but I'm going to ask that, whenever we give a presentation to the board, that, we provide a little bit more context about what's actually going on in the community relative to illness and mortality. I think the presentation, it really, it's not a completely full picture of what's going on. relative to illness. And like I said, I can't explain it in a 2-minute period. So, you know, I hope the board will take some of this information under advisement, and I appreciate the time. Thank you.
Okay. All right. Thanks, John. All right.
I make a comment in regards to John's, I guess one of the things he mentioned about testing.
Sure, John.
So I just want 1 minute. So he brought up a point about the surveillance, I guess, screening that was done at Chelsea, where they found people who had, I guess, demonstrated immunity, I guess, based on antibody detection, just above 30%. That type of testing is sort of static. You're just seeing who's developed immunity. You're not detecting active infections, which is what this type of testing that other towns have been putting into place are trying to do. So there's a big difference between the point that you raise and the point that that's trying to be pursued in terms of the screening itself. So I just want to point that out.
Okay, thank you, John. Any other questions, comments, hands raised? All right.
Thank you. Thank you.
Yep, thank you. Okay, so we're gonna move on to correspondence. Anybody get anything this week? I know, Jim, you've gotten something, and it's mostly about Market Basket, and I think you've already addressed that, correct?
So I brought the letters before Christmas. There was a complaint. I went up and actually I had one email complaint, I think, that came through your office, and then one call I had from somebody. The call was about crowding. The email was about people, primarily people in the aisles, not going the right direction in the aisles. So I went up and spoke with the manager on both. My understanding, and when I walked in, again, as I always do, I kind of look around first. They were counting people, so they had somebody at the indoor. They have flow when I was there, coming in one door, going out the other door. When I talked to the manager, he mentioned that when the numbers start creeping up, they start having people line up outside. So it's and he did, and they're mentioning over the loudspeaker that they're having they're following state and local recommendations and guidelines. So that sounds like that's working. And when I talked to him about the concern is, and I'm sure everybody has seen this, somebody going down the aisle the wrong way. His bigger concern when I talked to him was staff and vendors. And so the manager said, he'll meet with the staff and talk with the vendors and make sure they respect those aisle markers.
Yeah, I was there, probably about a week ago, and heard the announcement that they're limiting the capacity. They've got the entrance and exit one way on behalf of the state and the local board of health. And my son happened to be there, and he heard it, and he was so proud of us. So. And we hugged in the store, so I'm sure I was one of those people that. All right.
Jim, do you have to wear a disguise when you go in there now?
No, fortunately, there's enough people in that store. I just kind of walk in, go to the right, and just kind of loop around first. So that's the opposite side from the counter. So that works out well.
Mm-hmm. Yeah.
Well, with a mask on, nobody knows. It's one of those things.
Yeah. Yeah. Get a pair of fake glasses and a baseball hat. All right. Any other correspondence? Okay, and then I guess we don't have the minutes from December 30th meeting. So Mike and I talked briefly before the meeting started. We didn't get them, I don't think. Did anybody see? Okay, for approval. So we'll just do that another night. Member comments?
Thank you, did a good job.
I have member comments.
Okay, Louise, go ahead.
So I don't know if everybody remembers the issue with the temple in Groton and 2 town residents that there's a noise complaint that they are having with the temple's fan from when they cook food. It's
Right.
they complain about it being really loud. So we had another meeting with the Groton Board of Health this week, and they decided to have a site meeting tomorrow night at 7:30 at the Temple. And so we're gonna, go there with the full all the members of the Groton Board of Health, and I will be there, and Steve Gentili and Russ Arena, I'm sure, will be there. They live right there. So the fan will be running tomorrow night, and so we'll see how loud it is. Jim has been there many times and taken many readings, and so he has a lot of information to he has a lot of data accumulated. But I would like Jim to comment because he's in a tough position, so I want him to explain his position, so that I don't know if Russ and Stephen may be watching from home. I don't see them on the attendees, but so that they can hear this tough spot Jim's in.
So I don't have a problem with enforcement, so that's not necessarily the tough spot. It's the tough spot, or I said maybe the complicating spot, is it's between two towns. So just a quick kind of up to speed, noise complaints are handled under the state's air pollution control regulations, 310 CMR 7. And essentially, noise complaints are determined at the property line. Generally, the process for us trying to investigate noise complaints is to talk with the person who feels that there's a violation, try to figure out when it's happening, try to go and hear what they're hearing so we know what it is that they think is the violation. In the case of noise, the state has two standards, or there's two ways that a noise can be a violation. One if it's 10 decibels over background, and one if it's a pure tone. I don't think I've ever heard a pure tone, so that one I have never experienced. So in this case here, we're measuring to see if the noise, and again, the violation is at the property line, if the noise that is of concern is 10 decibels above background. And so the way we typically do that investigation is to go out when the noise isn't happening to get a sense of what background is and get a reading, and then go out when the noise is occurring so you have a sense of what the difference in that noise is over background. And so if it's more than 10, you could consider it a violation under the state's regulations, and it's enforceable. So the concern I have is I met originally, we're talking about a year ago, this past July, I think was when we started, met with Mr. Arena out there on his property, brought me to where the property line is. It's open to the temple. The fan wasn't running that day. He has told me that the fan, it's all day, every day, Thursday, Friday, Saturday, Sunday. They have activities. So I picked Wednesday to go out as a background day. Started going out on Thursdays. I've been out a couple of Thursdays, haven't heard the sound. I went out one Friday evening about 6:45, didn't experience the sound. I've made some other inspections. I told Deuce it's a year now. I have to go back to my records and see the other dates that I was there. I happened to be at the office now just about a year ago, and Mr. Gentili emailed saying, hey, that noise is happening now. So I went over to see, then I could at least hear what the noise was and get a sense of it. So then I started taking measurements based on that noise. I think it was on Saturdays is when the noise was happening. And again, I have to go back and get my notes to tell you all the different dates. I off the top of my head, I can't do that. And the town has a sound meter, but it's not calibrated. It's mostly to determine kind of the difference in noise. So just to get a sense of whether the violation's happening. But the state of Massachusetts, the Department of Environmental Protection, allows us to borrow their sound meter, which is calibrated, so that if we believe we have a situation, we can actually use a meter that if we had to go to court, would stand up in court. So I did, after I determined with the town meeting that there was a difference that might be significant, I went and got the state's meter and did the additional before and after testing just to get a sense of whether there was a violation or not. And as I think I wrote in an email and actually a memo to I think I provided to the selectmen, and I think the Groton Board of Health has it also. The difference was not enough that I felt comfortable enforcing or asking for enforcement. It was right at that 10 to 11 decibels over. So I'm not sure how it would hold up in court. And my recommendation would be that, and again, mine is a point in time now. As I mentioned to Lisa, I could sit out on the property line and do real-time measurements every 10 or 15 minutes, but I don't think that's practical. Whether it would be appropriate for the, and again, just to kind of go back to how we look at violations, the state looks at frequency and it looks at intensity as to whether something's happening, whether something's a violation. So, if someone blows off fireworks on the 4th of July, it's certainly exceeding that 10 decibels, but it happens so infrequently that it's not necessarily a sound violation, maybe violations of other rules, whether you're supposed to have fireworks or not. But so that difference, if something's loud enough and happening often enough, that's really where it needs to be for us to actually determine it a violation. So in addition to having it just be that slight bit of difference one side or the other of 10 decibels, and I've only ever been able to pick up the noise on that Saturday. Again, my recommendation was I didn't think it was enforceable. So if the applicants or if the town, our town, because of their residents, or if they, if they felt that was an appropriate thing to have real-time sound checks for a period of time so that you could determine whether it was just that, just on a Saturday, just when they had an event all day, like it was described to me, that might be a better way to get additional data to find out whether this is an enforceable violation. If it is a violation because it's happening with enough, over the decibels, whether it's happening often enough. That's kind of where I'm at with that. What kind of complicates that, I guess, probably for the Littleton residents, is because I can't really say that I think it's a violation because I'm not sure it's meeting all of those parameters at the state level. The Groton Board of Health is looking at this as it's not. They don't think it's a violation on the property line. So there's not much in the way that. And I'm putting words in their mouth, so I can't speak for them really, that they don't feel it's enforceable. If we don't think it's meeting the level of enforcement, they're at a loss to enforce it if that's the case. So that's what's complicating this. Louise, I hope that explains what it is you were asking me to comment on.
Jim, also the comment about you attending the meeting tomorrow night.
So, Louise has asked me to attend. I explained to her that just like your board is the Board of Health Authority in Littleton, the Groton Board of Health is the Board of Health Authority in Groton. I don't really have any standing there unless they ask me to attend and then ask me to participate. Just like anyone who comes to your meeting, if I attend their meeting, I would have to be recognized by the board. Now, I'm not saying that they wouldn't. I'm just saying that I told Louise I would ask the chair if he would like me to be there. And I was certainly willing to explain all of what I explained here tonight at that meeting. The board certainly knows the regulatory point of view because I'm sure that's come up at their Board of Health meetings regularly when they have them. But if, the chairman of the Groton Board of Health, who ultimately will do the enforcement, the board, if he thought it was of value to have me come and describe what I have done for testing and inspections on the site, I'm certainly happy to do that. I just don't. I don't have any authority to have them do something they're not comfortable doing because they are the Board of Health Authority in Groton.
Actually, what you just said, Jim, is to have you there to explain your testing data because you did take the testing. Ira hasn't done it. You did it, right? Yep. So I think you should be there.
And I'll talk to the chairman of the Board of Health.
Okay.
It's not my meeting, and like I mentioned to you, I don't really have standing except to the extent that they want me to be there to participate.
Yeah. I just think it'd be a great idea to have everybody in one spot with the data there. You know what I mean? Get everybody together on the same page, and then maybe it would put an end to it.
Question for Jim, if that's all right.
Yeah, go ahead, Kevin.
Jim, what is the outdoor decibel limit at the property line for noise pollution, sound pollution?
So it's 10 decibels over background.
What is background? 60?
So background is So background on King Street's different than it is, I don't know, up in Durkee Farm.
What is it in the country in the back of?
Yeah, so I mean, so that's why we go get a background reading first, so that we know what if it's 10 decibels over, that's where the violation would come in.
So what is the decibel number?
I don't. Again, Louis mentioned this tonight, and I haven't had a chance to pull out my records from the times I've been there. So.
And what was your measurement at the time of inspection?
Again, I don't know the numbers because Louise and I talked about it just before the meeting, and I haven't had a chance to dig all that stuff up.
Yeah, I mean, I think that's all integral to us trying to make a case to help these folks out with the noise pollution.
Well, I think there was only one time that he went that there was a significant change, right, Jim?
So I took the town meter out first just to try to get a sense of whether there was a difference enough that warranted getting the state meter. Again, if we were going to ask somebody to enforce this, I wanted to make sure they had data that was done with a meter. So if the judge says, "Hey, when's the last time that meter was calibrated?" I could take out the notes from the state and said it was calibrated on these dates. The town has a meter to kind of just judge if there's a situation there. So I was out once with the town meter to kind of get a sense, background, when the fan's on, whether I should go get the state meter. Once I did that, I went and got the state meter and did a set of readings to. Yeah,
I mean, I get all that. I just think it's integral to have the numbers so we can make a case to figure out if this is gonna work for these folks.
So we could throw some numbers out there. If the number was 60 background and it was 75, then it would be a violation.
Right.
So it really relies on what the baseline is.
Yep. And you have all that recorded somewhere, and
yeah, just not with me at this moment.
That's fine. Yeah, I mean, but could you relay that to Ira? And
I have, and I've provided for the Groton Board of Health my inspections.
And what did he say?
Again, it was one of these things where it's bouncing right there at whether it's just 10, is it 10 and a half, it's right from my reading, it's that close that my recommendation would be additional long-term kind of engineering setup that records in real time. So again, unless I'm going to take up residence in the backyard and take readings on a regular basis, it's just that point in time is
gold.
Yeah.
And Ira has no interest in doing any more readings.
Okay.
Again, the readings are done at the property line. So again, I need to kind of explain that it's not really Ira doing this. It's being based on the information I've provided. So this isn't a Groton against Littleton, and I really don't want that to be the case. So
I don't mean that Ira doesn't want. He has no interest in exploring it further, I guess, is what I should say.
I'm curious what the train, with the sound levels of the train horn.
Oh, I was there. It spikes the meter.
Yeah, I bet it does.
It spikes the meter because I happened to be there when the train went by.
Yeah.
And Mike had something he wanted to ask.
Yeah, I've been sort of, the mysterious to me is, let's assume for the moment that it was sufficiently and consistently above plus or minus 10, okay? The variance, in other words, it was, quote, enforceable, all right? What action could the Groton operation take realistically to keep the kitchen operating and to keep their next door neighbor in Littleton happy? What would they have to do?
So if we were going to do enforcement, and let's say I went out there and found that it was a violation, I would certainly have sent that to Groton to say, hey, look, it's a violation. They could then discuss with or issue an order if they didn't. Obviously, you first say, hey, look, there's a violation here. We'd like you to correct it. They could issue an order based on 310.7 that it's a violation of the air pollution regs, and they need to do some mitigating measures. So, and again, it's up to a someone who does that kind of work to come up with something.
Sound barrier, they could adjust it so it's less cubic feet per minute. I mean, there's a bunch of different mitigation strategies.
Sometimes they put fencing around it or just sound deadening around it.
Recognizing it and then
The temple has gotten a quote to add a sound attenuator, and the cost is $14,000. And they said they would split the cost with our Littleton residents. So, of course, our Littleton residents do not want to have to pay for that.
Mike, did you get your question answered, Mike?
Yes, sort of. And it's not up to Jim. I do understand he's right at the threshold of detecting. Yeah. And so it's frankly a little hard for me to believe that that how much of it. Let me ask you this, Jim, and maybe this is a hard one to answer, but what is your sense of how much, forgetting the law for a moment, how much reduction in decibels can the Littleton neighbor detect? In other words, what would it have to drop to beyond where it's sitting right now for the Littleton residents to say, oh, I can barely hear it, or it's acceptable? You were there, so what I'm asking is there any sense at all of this is not like a jet plane flying overhead every 30 seconds, okay? So my question is, where does this background noise become tolerable on weekends? You know, is it 9 decibels, 8.7?
I guess the other thing I could really discuss that if it was 9 decibels, it wouldn't be enforceable. So that would have to be the acceptable level.
But they're always going to hear it.
That's right.
Because it wasn't there before.
That's right.
Exactly.
Okay. All right.
Do we know, is there an event happening tomorrow night, or they just assume Thursday nights there's something going on?
The fan will be on tomorrow night from 6:30 to 8:30.
How do they? 8:30. Did Steve and Russ know that, or is that just they know that every Thursday night it's on?
There were people from the temple at the meeting.
Oh, okay.
And so it was arranged to have it tomorrow night because the temple.
Oh, okay.
I mean, the fan's going to be on.
Are they bringing the decibel meter?
No, because Ira doesn't want to take any more readings. So the chair is going to use an app on his phone.
Oh.
So again, I have to kind of stand up for Ira. The violation would be need to be measured at the property line. It's making it sound like he doesn't want to do his job, and I don't think that's the case.
No, this is something. Yeah, this is.
I don't think I don't know, Jim. I am just kind of disappointed, but I know it's a tough situation all around.
Jim, how many people live in the Littleton residence that have the complaint?
I don't know.
There are only two houses that are directly affected by it. They are on Ernie's Drive, and all the other houses on Ernie's Drive don't hear it, or they don't hear it to this extent. And I think it's because where their houses are situated.
Okay, so it's Ernie's house.
Ernie's Drive.
The houses are on Ernie's Drive.
Okay, so Ernie is the one who has difficulty with the sound. Is that correct?
Oh no, Ernie's Drive is the name of the street.
Oh, I'm sorry. I thought that Ernie was. I was trying to cover.
Ernie, I know.
I'm sorry. Okay. No, I was just going to make the suggestion. Maybe this is just, leftover from the old days. But my suggestion would be if perhaps the temple folks would be very interested in spending $300 and give a gift, which they can deduct from their already deductible taxes, as a donation to the neighbor, that he can don a pair of Bose noise-canceling headphones.
Yeah, no.
Put it on, and just for 2 hours, he can be in silent bliss.
No, but it's every weekend.
He can listen to music.
Louise, is it worse
or anything else?
Worse in the winter? Did they say if it was like worse?
Yeah, that's a good question because there would be no leaves or anything. Yeah. I don't know that answer. But,
okay, I'm sorry.
They're kind of at their wits' end. They're really frustrated.
Hi.
Wow.
Hello.
So we're going to see if Jim can make it tomorrow, and I'll join you somewhere. Louise, we can talk later.
Sure.
Yeah.
Okay.
Yeah, I will talk to Jason Weber, who's the board chair, tomorrow.
Thank you, Jim. Can you just let me know one way or another whether you'll be able to hopefully be there.
Sure. I will.
Thank you.
All right.
Thanks, Jim.
Thanks, Jim. All right. Any other member comments at all? And okay, and public comments?
Yeah, we have a hand up.
All right, state your name and your address.
Yeah, it's John Kessler, 171 Hartwell. Hey, this noise complaint is, it brings me back to my college day. I'm a mechanical engineer by training, and this noise complaint sounds like it recently happened. So I worked in a dog food factory, and one of the first tasks they told me to do was figure out why this noise is occurring with the exhaust blower that they have in the factory. We brought in a sound engineer. Sound engineer monitored it for about an hour or so, and they found out you can look through the spectral analysis that it's the bearings. So if this is a new problem for the restaurant, you may want to tell them if they are maintenance bearings to grease them, or if they're not maintenance bearings, they should replace them, especially if this is a new issue. The $14,000 sound attenuator, they might be able to solve the problem with grease or with new bearings on the blower. So
Wouldn't that be awesome?
yeah. So sorry, I was like chomping at the bit during the whole discussion, but thank you.
No, thank you very much, John. That's a great idea.
Okay. Dave, do we have anybody else with their hands up?
Nope.
Okay. So before we adjourn, just going to, so next Wednesday, January 13th, I think what Janet has us doing is alternating public hearings and just COVID meetings. So, and I know we've talked about like cutting back on the meetings, but I think with the testing issue, to stay on it. So, so the next meeting will be Wednesday, January 13th, and I think we'll have Ivy Road. I don't know, Jim, have you gotten in touch with Ian yet? I know you got a lot going on, but
I touched base with Ian. I have an email into Chris. That's one of the pieces I want to make sure we can feel comfortable with, is that Chris feels comfortable with what it is that the applicant's asking, and before Ian designs it. Okay.
And if you don't hear from Chris, can you let us know so that we can take that off the agenda for next week?
Absolutely.
I know it's like we said, we've had a couple of holidays and you're dealing with vaccinations and everything too. So, all right. So next meeting will be Wednesday, January 13th at 7 o'clock. And can we get a motion to adjourn? I guess everybody okay with that? Are we ready to adjourn?
Make a motion to adjourn.
And get a second?
Second.
Great. We'll do roll call. Kevin Baker.
Kevin Baker, yes.
Gino Fratelloni.
Yes, Gino.
Louise Nichols.
Louise Nichols, yes.
Mike Zeldin.
Mike Zeldin, yes.
Yes. And Lisa Flanagan. Yes. All right.